host Arya Parekh, and today I'm joined with orthopedic Dr. Vinod Vaishnav. He usually specializes in science behind bones and fixes the joints that we usually break. So, Doctor, welcome to today's
Thank you.
podcast.
Good evening.
Good evening. Okay, so let's start. The first question:
Yes.
what inspired you to choose orthopedics as your specialty?
So there was nothing in particular like a moment or something, but once I finished my UG undergraduation MBBS post graduation, so yeah, I mean orthopedics was like an end branch to me at that time. So I didn't have to specialize much into any other, and it covered whole the body.
Yeah.
So that inspired me to take orthopedics, and I was more inclined during the MBBS also towards orthopedics.
Okay, that's interesting. So, what one bone or joint myth that most people believe but is completely wrong?
There's no one common myth. Yeah, people think that bones become soft in old age and osteoporosis comes in old age. But osteoporosis can happen in young age as well. So if you have a sedentary lifestyle, not a very active lifestyle, people can have osteoporosis or soft bones even at young age also.
Okay. Long screen time and sittings, are there
And
any
definitely, yeah.
posture or any problems that people face nowadays?
Yeah, this is very common. I mean, we see it day to day in the clinics. So people who sit for too long, a lot of youngsters, a lot of phone use, computer use, they do complain of neck pain and the lower back pain, which is very, very common at this
So,
age.
what are the common exercises that people usually
So basic exercises. One thing is you have to be very active. Okay.
Yeah.
Avoid very long posture, a single posture for too many hours at a stretch together. And the basic neck and the back exercises. So we usually refer to physiotherapists, but these exercises are very simple. If you're active, you're playing everything, that takes care of these kinds and pains.
Okay. So, rapid fire rounds, fracture or ligament tear, what's usually worse?
And both are worse for as an injuries. It depends what kind of like fracture takes 6 to 8 weeks to heal.
Okay.
Ligaments for a soft tissue heals comparatively early in maybe around 2 to 3 weeks.
Okay.
But like some ligaments, like knee ligaments, like an ACL, they need a surgery. They take 3 4 months to heal. So if it's a small fracture in the finger, it's better than having an ACL ligament injury in the knee because that will need surgery. The finger fracture will not see. So it depends what kind of fracture, what kind of ligament you have.
So, gym or yoga, what do you recommend for joint health?
Both are good. Gym is mainly for strengthening the muscles, bones, and yoga is more of a flexibility.
Yeah.
So both are recommended, but every kind of exercise has to be done under proper supervision and gradually and slowly increasing with this thing. You cannot be blunt with the exercises and too much of exercise in a single day. Exactly.
Yeah. Ice pack or a hot bag, which one is usually better during pain?
So what kind of pain it matters? Like if it's an injury or an acute pain, ice packs really helps. But it's a chronic muscular pain, like you have a neck pain, you have a back pain without injuries.
Yeah.
Heating really helps. But you fell down, you broke your ankle, you broke your wrist, your ligaments are injured. At those moments, ice packs are both are equally effective.
Okay. And one food you always recommend for bone strength and good density?
Usually the milk and milk dairy products, green leafy vegetables, food rich in calcium and vitamin D. So pulses, cereals, grains, all those are good.
And one habit that teenagers must stop today?
They should stop.
Yeah, that may harm their bones.
Yeah, so that's why I said a sedentary lifestyle. So if you're sitting for too long hours together in front of computer, using your phone or laptop for hours together, that puts a lot of strain on the neck and the back. They become gradually weak. So teenagers should be physically active. They should do gentle exercises every day because they are the growing bones.
Yeah.
So they have to be active. So constant one position and lack of sunlight is also very, very common in current scenario.
Okay, so vitamin D.
Yeah, so those deficiencies and people should be exposed to sunlight during the daytime.
Oh, okay. So that I think that's something everyone has to keep in mind now. So thank you, doctor, for breaking down details of the bones, the myths and medicines for everyone. So today, everyone listening, take care of your bones. And if you're interested in episodes like this, please do follow. I'm always posting interesting content. BioGenie with Arya Parekh, a place where science meets everyday life. Thank you so much,
Thank you.
doctor.
Thank you.
I'll see you
Pleasure.
next